happens. Also, I have a very high pedigree guest joining me on the show today. I had to steal him from the holiday mood to be on the show because it's very precious to this conversation. That's the foremost fertility expert, Dr. Abayomi Ajayi. I'm meant to have, or let me just say, I was meant to have two guests on the show today, but of course, my other guest pulled out, not deliberately, but because she lost a family member and she couldn't have been on the show. Thank you so much, Yuma. So she couldn't have been on the show, so she called for a reschedule. I pray that this time, anyone going through hard times, so losing one family member or another, may God pacify you. I know it's hard. Please stay strong. Okay, Lagos, it's 99.3 Nigeria Info once again, and I wouldn't want to keep my guest online for too long. So once again, I do have Dr. Abayomi Ajayi, consultant, obstetrician and gynecologist, public health consultant, maternal and child health specialist, and managing director, Nordica Fertility Center. Remember, I keep saying foremost because he really is the foremost fertility expert in Nigeria. He's also an associate professor, College of Medicine, University of Lagos. That's UNILAG, honorary consultant to the Lagos University Teaching Hospital, LUTH, and immediate past second vice chairman of the Association of Public Health Physicians, Lagos State Chapter. Dr. Abayomi Ajayi wears many hats, but I will just keep it at that for now. He will still be on our other shows in the coming year. All right. So, Doctor, good afternoon to you, sir. Oh, look at me. I've been staring at his name and I'm here to admit him. Now I've just admit. Okay. Hello, Dr. Abayomi Ajayi. Hello, sir. Doctor, you may want to unmute. Okay, I see. Okay, now he's connected to the audio. Hello, doctor, can you hear me?
Yes, I can.
Thank you so much for joining Maternity Line show this afternoon, for giving up your time this precious holiday period.
Terms and conditions apply.
I know, right? I told you. I don't think we'll be able to afford you. Thank you once again. May God honor you. Big thanks for allowing us to steal your time to be with us today. All right, so the discussion today, Lagos, it's important to carry you along. I just did not want to keep my guest online for too long before I introduce him. So what we are discussing today is cryptic pregnancy. And I would love to state that today's conversation, as earlier planned, is meant to feature, or was meant to feature, two guest speakers. First, Yemisi Adegoke, senior reporter and presenter for BBC News. Unfortunately, she had an unexpected family bereavement, so she called for a reschedule. I did say that. And by the way, Yemisi is an award-winning BBC senior news correspondent. Previously, she had gone undercover to expose the fertility scammers.
More conversation, more talk, more right after this. It's that time of the week again. Are you ready to dive into the wide world of news? Join us for the Hat Fact Awards every Friday at 3 to 4 p.m. on Nigeria Info FM. We are breaking down the best, the worst, and the downright Nawa stories that had everyone talking this week.
Oh, wow. Some people then to do.
From jaw-dropping headlines to the most outrageous events, we've got it all covered.
Y'all know how we do it, so let's get it on.
Tune in as we celebrate the stories that make you laugh, cry, and shake your head in disbelief. Whether it's the latest viral sensation or the craziest political blunder,
We are going to provide you with insecurity.
we'll give you the rundown on what's hot and what's not. And guess what? You get to vote for your favorite stories in our weekly awards. Who will take home the coveted title of the best stories of the week, and which tale will earn the infamous worst story of the week? Hard Facts Awards on Nigeria Info FM, where we turn the news into entertainment.
99.3 Nigeria Info, your number one station for talk. Let's talk.
All right, Lagos, this is Maternity Line Show. I am Zaynab Yakin, and I was telling you just before that short break what Jamie C did, a journalist with the BBC News. She went undercover to unravel, some quote and unquote fraud practices or some scam procedures that people engage in, desperate women indulge in. She was previously on the Morning Crossfire some 3 weeks ago, the show which I also produced, and I did give her my word that even though she is not here today on the show, I will give a mention, and this I am doing currently. All right, so we move swiftly to bringing Dr. Abayomi in. So this conversation is very important, cryptic pregnancy, particularly because of women whom appear desperate. And I understand in the coming year, a lot might be going on, especially with those who are been praying, looking unto God for the fruit of the womb. So it's very important to have this conversation. Now, here is the thing. Doctor, a lot appears unclear about cryptic pregnancy. I've heard and read that women are sometimes sedated and operated or giving all sorts of anesthesia in order to just carry a baby, quote and unquote, to term. And this baby is hidden. We can't even see that she is pregnant. So there is a lot of misconception around cryptic pregnancy, which we need you to please help us understand. What exactly is cryptic pregnancy, doctor?
So thank you so very much. And thank you for interrupting my holidays, but it's all for good. Now, when we talk about cryptic pregnancy, why there is a lot unclear about it is because it's not a common phenomenon. Cryptic pregnancy means that a woman who is pregnant is unaware of the fact that she's pregnant. Okay. So, and this rarely happens. Most pregnancies are detected between 4 and 12 weeks.
Right.
Okay. So because either there are symptoms or there are changes or you've done a pregnancy test, something must have happened. So majority of the pregnancies are detected by 12 weeks. Now, but for some reasons, some people are either not aware that they are pregnant or they are denying that they are pregnant.
Denying.
And that is what cryptic pregnancy is. It's definitely different from the situation in Nigeria.
Oh, tell us.
When these people who say they have cryptic pregnancies are actively looking for babies. Do you get me?
Very well.
They have infertility. They are actively looking for babies. So if you follow my drift about what cryptic pregnancy is, these people don't have cryptic pregnancy. What they've done in Nigeria is they've looked for something that occurs rarely. They've now made an industry out of it because it's a scam.
This is a big one. Though.
So, yeah, because it's a scam. You know, I listened to that BBC. I didn't even know that I'll be talking about it. I listened to the BBC report, and the commissioner in Anambra State said something very germane.
Right.
That there is no cryptic pregnancy without a baby trafficking, the baby trafficking industry. So what we now call cryptic pregnancy relies essentially on people trafficking babies.
So
we need to differentiate between the two of them. Just like a few years ago, people surrogacy, even up to now, they call all kinds of arrangements surrogacy, that's not surrogacy. So people now look for a convenient terminology, medical terminology, and label whatever criminal enterprise that they are into so that it can have a name and probably be pushed into the public domain and to have a face.
Oh, wow. So I quite understood most of what you have said, but I'm curious. Some year ago, I think over 2020, I saw a report detailing one Miss K who had presented herself to a sick bay. It happened in the southeast region. In Enugu State. She had presented herself with a history of lower back pain, abdominal discomfort, and constipation. Unknown to her, she was in labor. And she had reported to the outpatient department of the hospital several months ago, complaining of several symptoms and all that. Now, however, she only remembered having unprotected sexual intercourse many months ago, but she still did not realize that she was pregnant until she presented herself at the hospital. I saw this is a story, it's on researchgate.net. Yes. And then that report is titled Unexpected Delivery, a case report of cryptic pregnancy in Nigeria. It happens to be the very first. And I was just thinking to myself, is this for real? Because she did deliver of the baby on the spur of the moment, and she was not going to touch the baby. And
actually, it's not the first report. I've seen what you said before, but let's cut it. Let's get it right. I never said there is nothing like cryptic pregnancy. I said it's a rare phenomenon.
Yes, you said so.
Okay, let me put perspective to this. People who will not discover that they are pregnant until the 5th month. Okay, I said majority of the people will know that they are pregnant by the 3rd month. By the
3rd month, you said, yes.
Okay.
12 weeks.
When we look at people who will not know that they are pregnant until the 5th month, it's about 1 in 475 women. Okay, that is conveniently, let's say, is about 2 in 1,000 women. So not that is that rare. But the kind of discussion which I've seen before, which I think belong to people who deny they are pregnant, come later on. I've seen that before in many years ago. This young girl who was being dramatic, and she was cool, and she was pregnant, and the doctor, she wake up her mother at the night and say that she in her dream, and the mother will start praying, and she was pregnant, but it was concealing the pregnancy. One setting, that's when she came. Those days, scanning is not as it is now. We said that she had a baby. We said there was somewhere we had out, and the mother said no, it's not possible. So they had the baby with a scan and so on and so on, not to deliver. But this is about 2,500 4 out of 1,000 pregnancies. So this is a very common occurrence. People who are trafficking want to drag this very rare thing into our everyday living by calling this child trafficking thing cryptic.
Right. Doctor, I'm trying to separate. It does happen, but phenomenon, and you did say that it's about 1 in 2,500 or 10,000. So to say that these people actually are pregnant, but they're concealing.
Some people know that they are pregnant. Majority of them, they will belong to the 1 in 75 by 20 weeks. Okay, they are pregnant, and people at risk about in that category are people who either they have irregular cycles. For example, let's say a woman who she's breastfeeding. This idea that breastfeeding is protective, so on and so forth, and then all of a sudden she's ovulating and she's pregnant. And because she was menses before, she probably would not know that she's pregnant. But most of them will go roughly between the 3rd month and the 5th month. So the worst are they are told. Now, but there's a group, okay, that they don't want to believe that suppressed. Sometimes anyhow is part of this. But other ladies like young girls try to conceal it also is part of this. Okay. And of course, the other thing that they who have irregular menses, that people polycystic ovarian syndrome don't menstruate regularly, maybe a few times in a year, they can also get pregnant. But majority of them will probably know before 5th month. But the one that we're saying is 1 in out of 2,005 is the one before they know that they treat.
All right. Thank you. So in a case or in a situation whereby they don't even know if it's labor. I'm also curious to know, to understand. So these symptoms, some of the symptoms that they are feeling, which I assume are unknown, that to tell that this truly pregnancy, is vomiting, being slow, weak, because what's very tough to notice when okay, even until I think a month, until about 6 weeks, did not know. So busy, hasn't really gone, and then for an ultrasound scan, and I found out that it was pregnancy. So now, in this situation, is it even possible at all, doctor? Is it okay? You are going to say something
because is the way people who are practicing cryptic want to go. This is what I mean. They are not in between the real cryptic pregnancy in Nigeria.
Okay,
you understand? This is what I mean. It was for pregnancy. Okay, that's another group who might have cryptic pregnancy, but you said 6 weeks.
Yes.
Most obviously, like I said, we detected between 6 weeks and 12 weeks. All right, it's just but normal. It's almost normal. I want to have to really cryptic pregnancy. You understand? Now, the thing again about cryptic pregnancy, which you said is rare. One of the things that you want antenatal care because when you are not. But this ones, the people that we're talking about, they go antenatal, and this is the habit. So it's a fetus scan with this condition, medical condition, which is a rare condition.
Very well, very well.
Now let's start the treatment. Then we'll probably use the word.
Now, doctor, we move away from here. Pregnancy, which is rare, and the fact that the woman doesn't get to go for antenatal clinic. Does this, in a way, pose the baby at risk, quote and unquote?
The mother, both the mother and the baby, will be at risk. Because probably she will not be eating the right things in pregnancy. She might be anemic. The chances that you have not localized whether the baby is coming with the head or where's the placenta, all those things are at risk, even to the mother. And of course, the baby too could be at risk. Okay. So yes, that is the cryptic pregnancy itself. But the ones that we see in Nigeria, these ones, they go for antenatal care. So that's why I don't like using that label cryptic pregnancy with this thing that is this scam that is going on in Nigeria.
So they do go for antenatal care because it is not real cryptic pregnancy. So they are only hiding under an idea of unknown. They don't know, and they know. Wow, this is such a confusing indulgence. Anyway, Lagos. I do have a Dr. Abayomi Ajayi, Nigeria's foremost fertility expert, consultant, gynecologist, obstetrician, live on the maternity line. In case you have a question for him, it's the right time to ask, because the discussion we are having today is very important to understand what cryptic pregnancy is. People get pregnant and they act like they don't even know, because there is scam somewhere. We do have a call. Good afternoon, Nigeria Info. Oh, sorry about that. Okay, so
sorry, Zaynab, you know what I'm saying is this. These people they are not pregnant. So these people in Nigeria who say they have cryptic pregnancy are not pregnant. This is not even only from me. They are not pregnant. The babies are being, I don't want to use the word kidnap, but there's baby trafficking associated with this. These women are not pregnant. That is the difference. But why they call it cryptic pregnancy is that because they say you cannot detect it. So they say it's cryptic pregnancy. But you can detect cryptic pregnancy. If you do a scan, if a woman is really pregnant, you will see the baby there. True. Okay? So this is not cryptic pregnancy in any way. This is a scam, and that's why I'm uncomfortable the moment we start putting the two of them together.
It's very important.
These women are not pregnant.
They're not pregnant at all.
No, they're not.
There is baby
they're not.
Fraud or factory or whatever somewhere.
There's a source of the baby, and you saw it even in that BBC report.
Yes, I did.
Saw the source of the babies.
Oh wow. Okay, uncovering the reality of cryptic pregnancy, avoiding the scams is the conversation. In order to avoid the scams further, it is why we're having this discussion. Good afternoon.
Good afternoon, ma'am.
Good afternoon.
Says that
Oh, I think you are calling the wrong show. You might want to call Kids FM. You sound like a little angel. It's Maternity Line Show. If you're trying to call into the show, 0201277093, 0201465790, 0809-597-5801. I mean, 05 is the number. I have this one calling. Oh, okay. So we lost that. So, okay. Is calling back. Good afternoon.
Good afternoon, Zaynab.
I'm with you.
Okay, in addition to what the doctor said earlier on, what they do is they inject those women with hormones and tell them that it is only that hospital they can use. So when it is time for them to give birth, they will tell them to come for delivery. They will sedate them. Then the baby they have collected from somebody else, either through crook or somebody who wants to actually give up their child, they will now put it beside that person. The person will wake up and find that baby beside her. So by the time the yawa will gas will be when the husband say he wants to do DNA test, and they will now find out that that baby does not belong to them, and the wife will be blamed for that. It's so sad that Nigeria, they can be doing such a thing. Some people in Nigeria can be doing such a thing that is scandalous.
All right. Thank you so much for your submission. Doctor, from what my first caller just mentioned, the issue of unreal cryptic pregnancy because there is a baby factory somewhere, quote and unquote, does this also influence paternity fraud in Nigeria?
Maybe, but paternity fraud is a little bit different. You are saying that I'm the father of a child that I'm not. Though this cryptic pregnancy, when you look at it, we are just like your contributor said now. She was dead right. That sometimes the man now says, no, this child is not my child. And we've had, there's been a case in court about that the man actually sued the woman and said, I don't know where you got this child from. You know, so it's a little bit different. In paternity fraud, the woman says this is your child when she has had the child for another person. It's a subset of paternity fraud, but it's not, the idea is not really, it's even probably, I don't know which one is worse, but it's also as bad as that, because there is a lot of child trafficking in paternity fraud. Most of the time, the woman is pregnant. It's not that she's not pregnant. But this one involves kidnapping a child because, look, adoption is different. There is a way to do adoption. Anytime you take a child from another woman and give to another woman, it borders on, I don't know, I'm not a lawyer, but it borders on...
Without Without
whether does the woman have the right to just say, I give you my child? Because most of the time is that they're sold. We are turning babies into commodities in Nigeria.
Right.
So they're sold. Even the ones that give consent, they're sold.
Doctor, from her submission, there is another point I would love for us to touch on, which is injecting certain substance into the system. In the case of this paternity, cryptic denial cryptic pregnancy. Somebody was trying to call. Please do call back after this question. Now, doctor, let's talk about that. Is there any health consequence, perhaps bad consequence, of injecting these substance into the system in an attempt for...
Fortunately, I don't know what they inject, so I might not be able to make any comment about that.
Okay.
I don't know what they inject. So but definitely they probably have a concoction, because we follow that. The BBC report is probably the closest I've seen. I've heard so many times because, of course, I have a clinic in Asaba, so I know what's happening in that part of the country as well. But I've never really been so close until I saw that. And sometimes I doubt whether whatever they're injecting into them, I don't know what it is. So I don't know what the consequence will be.
All right, doctor, I have this question. Someone sent him a message saying, please clarify to the public that a cryptic pregnancy is normal pregnancy. What makes it cryptic is that the woman doesn't know she's pregnant. It's the lack of knowledge that makes it Cryptic. What we have in Nigeria is pregnancy fraud. I think doctors did speak on that previously, so I don't think there is anything else to clarify. He did make points, a very notable point on it. If you're still trying to call, 0201-277-0993, 0201-465-7190, 0809-597-5805 is the WhatsApp number. Now, doctor, in 2 years ago, I think that was in 2022, a member of House of Rep did call attention of the federal government, saying that the issue of cryptic pregnancy in Nigeria must be traced to the grassroots and awareness should be brought up on it. Do you think that our government is laid back in the context of cryptic pregnancy? It's mouthful. Cryptic pregnancy, making it easy for Nigerians, for people, for women, desperate women who indulge in this practice. Is it that the government is laid back?
Well, I don't know. Government, yes, has a part to play in it, but I guess it starts from the individual. Majority of the women who take part in these things know they are not pregnant. So they are collaborators. We heard from the woman in Anambra State, from the BBC report. Mm-hmm. When the commissioner now started becoming persistent, threatening her that she will not allow her to take the baby home.
Right.
You know,
that part.
She changed her narrative, immediately changed her narrative. Mm-hmm. So that tells you that she, from the get-go, she knew.
Got it. All right.
And the commissioner said, look, if anybody comes to claim this baby, I'm going to give them the baby. Because telling the couple that I know that this child is not your child.
All right. Doctor.
So there is a lot of collaboration. So yes, the government, who is going to report when you are a collaborator? Do you understand? But I still agree, the government should probably be more firm towards this. It should be criminalized so that people will stop hiding on that day. So it's not only even the collaborator who can report. Concerned citizens can report.
All right. Thank you. Good afternoon.
Good afternoon, Lady Zaynab.
Good afternoon, Mrs. Oboli.
Good afternoon to the doctor as well.
Doctor can hear you. Please go ahead, Mrs. Oboli.
So I feel that, just like the doctor said now, the collaboration makes this cryptic pregnancy, honestly, it's a mouthful, like you said, makes it thrive, because I believe the people that perpetrate this capitalize on the fact that the people that are patronizing them are desperate at all costs, not minding the fact that they tend to die. Some people die, Zaynab. Some people really die in this process. And so, because it will continually thrive, except there's a sensitization, a very vast one, that what you are putting yourself into might end your life. So if these people don't patronize them and this business does not thrive, I think it's a step in the right direction to nip this in the bud. It's not welcoming at all, honestly. And thanks for bringing the doctor to analyze this. And thanks for speaking to it as well. Have a blessed celebration, Zaynab.
You too. Thank you so much, Mrs. Oboli. Doctor, I do have more questions, especially with regards to the hormones when the injection, the substance is injected, but because you said you don't know, I know you're not that you don't know clearly. You've said it, but I'm now stuck because the questions I have outlined here have to do with women going through this process. What is the health implication? We've also answered some of the questions I had here earlier, which has to do with when they go for ultrasound scan, do they see the baby? How is the symptoms? How do they get to know that they are pregnant? And since we've been able to clarify, we've made a lot of clarification, we've been able to distinguish between real pregnancy and the unreal one, which is even rare. So at this point, I would love to say a very big thank you for giving up your time to join us today on Maternity Line Show. It's a great honor, and I don't take it for granted. Dr. Abayomi, Abayomi. Thank you so very kindly. So before you go, sir, what do you think government should do going forward? Because I asked the question in that regards before. You did say that it's collaboration. The collaborators know what they're doing. So do you think government needs to be more strict so women are not indulged in this heinous practice, I call it?
So I agree that probably there should be laws under which these people can be prosecuted, so that even if you're a collaborator, you can also be prosecuted, so that will probably discourage this kind of heinous thing that is going on, because the worst thing that we can do is to turn children into commodities. And I think everybody should frown at that, and so probably that's where government can. But before that also, just like one of the contributors said, there's a need for a lot of sensitization to educate these people, and then of course to probably put stern laws into place to discourage this.
All right, doctor, thank you so much. I do enjoy the rest of the year and do have a blissful 2025 ahead. Thank you. May God honor you.
My pleasure. Thank you also for inviting me, and I wish you the very same.
All right. Right, doctor. All right, Lagos, we are still very much live on Maternity Line Show, but I'll be going on a short break. After this break, I'll bring Temidayo into the studio to come and wish herself a...
More news and information coming up. We'll be back in a moment.
It isn't just about your safety alone. The lives of other people are in your hands. Whatever you do, be responsible. Don't drink and drive. This is an initiative of the Safe Roads Campaign, brought to you by Pernod Ricard Nigeria.
This is it. The ultimate stage for young minds to battle it out.
The governors are above the law. They tend not to lean on to public participation.
Governors can make any decision without fear of
what remains of a person's identity if it's only measured by external.
The urgency to safeguard life should outweigh preserving cultural sites.
Auditions for the I Beg to Differ Secondary Schools Debate Tournament is on. Do you have the passion, the intellect, the fire that stand above the rest? Then prove it.
The hallmark of any thriving society is an institute.
Study organization should be planned carefully into the data.
Standardized tests is a
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.